Hi there, I'm Inder Birdi. I'm a cardiac surgeon, and you may have seen me on the Channel 5 show, The Surgeon. And if you watch the episode, you'll completely understand why I'm so passionate about early diagnosis and expert monitoring of heart conditions. The programme beautifully captured the reality of modern cardiac surgery, real behind the scenes. But beyond the drama of the operating theatre, the story of the patients who so generously shared their personal journey with the world revealed something that I have known for many years. That heart disease doesn't develop overnight, that early diagnosis and monitoring allows timely intervention, and that timely intervention leads to a lower risk and better outcomes. I've been creating deeply informative videos for prospective patients for 15 years, but the show made me realise that as doctors, we had to work even harder to get this message out to you. So we will continue to create videos that help and guide patients with heart concerns. And if you want to know more about your heart conditions or recovery after heart surgery, or if simply you want to know how to keep yourself healthy, follow the YouTube channel. It's completely free and it's a recognised YouTube licensed medical site. But if you want something more from us, we've developed the Cardiac Surveillance Programme to help you much more directly. If you want to join this programme, our clinical team will evaluate your condition to establish if you've got a heart condition, and if you do, what's the best treatment or monitoring plan for you. If you've got a healthy heart, we'll give you some advice on how to keep it that way based upon any cardiovascular risk that we detect in your body. And if we do detect a heart condition, you may not need surgery, but you may need active long-term monitoring. And that strategy will be something that we will create for you to give you the confidence to get on with your life, knowing that when treatment's required, we will time it perfectly. Not just a wait and see plan, but an evidence-based monitoring schedule based upon the best clinical data and medical practices as they are today. And we know they change all the time. And as they change, we'll know about them. Now, if you do need treatment, we can offer every credentialed interventional strategy from traditional breastbone surgery, or even better, keyhole heart surgery if you're suitable, something we've been doing for over 20 years. We can even evaluate if catheter-based treatments like TAVI or stenting of your heart arteries are more suitable for your specific case. And with our options, we'll present them to you so you can decide what you prefer. But what if you've already undergone heart surgery? Well, then we'll be able to ensure a proper follow-up program that keeps you in optimal health going forward, because something that patients don't often understand is the fact that you've had heart surgery doesn't mean that you're fixed, and ongoing monitoring is still a requirement. Now, if you simply wish to understand your heart risk, perhaps because you've developed symptoms that worry you like breathlessness, chest pain, palpitations, or dizziness, or perhaps you're very well, but you wish to understand your cardiovascular risk because you've got a family history, then the Cardiac Surveillance Programme will still offer you vital reassurance. We ensure that if intervention is ever needed, it happens precisely at the right time. When you join the Cardiac Surveillance Programme, you're not just booking an appointment. You're entering into a partnership with a world-class cardiac team, something we've built here in London. You'll receive priority access to our consultants at the time that suits you, not one that suits us. And you will benefit from advanced research-led insights that ensure you always are offered the best that modern medical science can offer. Our diagnostic and treatment plans are continuously informed by the forefront of medical research. And crucially, you have access to the most advanced comprehensive treatment options available today. Now, we also understand that ongoing private healthcare is a financial commitment, especially if you're not covered by medical insurance. And that's why we've also structured a membership plan to allow you to spread the cost of your ongoing yearly tests over a 12-month period. Now, this has the distinct advantage of locking in today's price, which is really helpful, protecting you against future increases, whilst also guaranteeing you priority access. Now, you might not believe this, but the cost of an annual checkup is the same as a cup of coffee a day. And it means you won't be waiting for an emergency. Instead, you can take care of your life while we take care of you. So, if you've recently been diagnosed with a heart condition and you're unsure what this means and you want to know more, or if you're experiencing worrying symptoms, or if you've undergone heart surgery and you want closer scrutiny going forward, or if you simply want to take control of your cardiovascular health, the Cardiac Surveillance Programme is designed to provide continuous expert scrutiny for you. If you want to learn more about how we can support your heart health, click the link below and one of our team will be happy to assist you.